In my decades of clinical practice, I've watched health tracking evolve from patients scribbling in food diaries to wearing sophisticated devices that capture every step and every heartbeat. And I've got to tell you, the data coming out of these wearables is finally giving us the evidence based answers that we've been waiting for. Let me share some remarkable findings from a study just published in Nature Medicine. Researchers linked Fitbit data from over 6,000 people to their electronic health records and tracked them for a median of 4 years. And what they found? Mortality. It's about preventing the chronic diseases that steal quality of life long before they shorten it. Here's what caught my attention. Participants who maintained higher daily step counts showed dramatically lower rates of six major conditions. We're talking obesity, sleep apnea, acid reflux or GORD, depression, diabetes, and hypertension. Now, I've been preaching lifestyle medicine for years, but this study puts hard numbers to what we've suspected. The magic number, around 8,000 to 8,200 steps per day, emerged as a protective threshold. Above this level, participants showed consistent protection against developing these conditions. For obesity, sleep apnea, GORD, and depression, the relationship was linear, meaning more steps consistently meant lower risk, even beyond that 8,000 step mark. But here is where it gets interesting from a clinical perspective. For diabetes and hypertension, the benefit plateaued around 8,000 to 9,000 steps. More wasn't necessarily better beyond that point. This tells us something important about how our bodies respond to activity. There's a dose-response relationship, but it's not always a straight line. Let me put this in practical terms. If you're currently walking about 6,000 steps daily and you bump that up to around 11,000, you could reduce your obesity risk by roughly 50%. For sleep apnea, a condition I see wreaking havoc in my addiction medicine practice because it devastates sleep quality and recovery, moving from the 25th to the 75th percentile of step counts reduced that risk by nearly half. Now, what makes this study different from the usual take more steps advice? First, it tracked real-world behavior over years, not just week-long snapshots. These were people wearing their own devices, living their normal lives, not participants in a controlled trial trying to hit artificial targets. Second, it linked this activity data directly to actual diagnoses and medical records. We're not talking about projected risks or theoretical models. These are real people developing or avoiding real diseases. Here's what this means to you. If you're dealing with risk factors for any of these conditions, maybe you're pre-diabetic, maybe you're struggling with your weight, maybe you've got a family history of depression, your step count isn't just about burning calories. It's a powerful intervention that targets multiple disease pathways simultaneously. From my lifestyle medicine perspective, this is the holy grail. One intervention, walking more, affecting obesity, metabolic health, cardiovascular function, mental health, and even digestive issues. The mechanisms likely involve everything from improved insulin sensitivity to better stress hormone regulation to enhanced sleep quality. But let me be realistic with you. The study participants averaged 7,731 steps daily, well above the American average for adults over 60. So if you're starting from 3,000 or 4,000 steps, don't try to jump to 8,000 tomorrow. Build up gradually. Even moving from 4,000 to 6,000 steps showed meaningful risk reductions in this data. And here's something I found fascinating. Step intensity mattered too, but daily step count remained significant even after accounting for how briskly people walked. So yes, a brisk walk is great, but consistent daily movement, even at a moderate pace, that is what really moves the needle. The bottom line, we now have robust real-world evidence that maintaining around 8,000 steps daily can significantly reduce your risk of developing six major chronic diseases. That's not just about living longer, it's about living better, with less disease burden, fewer medications, and better quality of life. So here's your takeaway. Track your current baseline for a week, then aim to add 500 to 1,000 steps every week or two until you're consistently hitting that 8,000 step range. Your future self will thank you. I'm Dr. Fergal Armstrong, and this is MedHeads, where evidence meets everyday health. If this information was valuable, subscribe so you don't miss our daily deep dives into health research that actually matters.